My name is Christine Munna. I am an adult and geriatric primary care nurse practitioner. I started with Abode Care Partners back in 2017. I was seeing patients at the bedside, very clinical kind of work. Since then, I have transitioned into a leadership role with the company. I also oversee our quality assurance program, where I complete documentation audits for the company and do training on the documentation side as well. I was introduced to DocBuddy by our CEO at the time. He was trying to help us find ways to streamline our documentation, and dictation in our current EHR was not an option. And he came across DocBuddy and we decided to try it out. When we decided that DocBuddy and dictation made the most sense, we had multiple complaints from our providers, spending too much time documenting. In our quality assurance reviews that we do as well, providers would be asked to include certain things in our documentation that they felt they were very limited by in the EHR templates, or simply just didn't have time to include that. And also our work-life balance as well. So, trying to find better ways to spend less time working and more time with our families. I used to spend 20 minutes documenting a new patient encounter. I could spend 20 minutes or more typing, looking on computer screen, going back and forth, this system to that system, getting the information I needed and typing it out. DocBuddy in particular, and I think really dictation just also in general, that allowed me to cut that time in half, if not more, for some more straightforward encounters. So I think that has given me so much time back in my day, and certainly helps reduce burnout. The voice commands in DocBuddy, yes, I'm a huge fan of the shortcuts and the voice commands that are available. We have developed for our team many templates that we use for our voice commands. So we have templates for like a new patient visit or like a transition of care, advanced care planning. DocBuddy has allowed us to include more detailed information in our documentation to ensure that we are supporting the levels of service and claims that we're billing for, and really just to better improve our documentation. I've seen a huge improvement in more relevant details and just better quality of notes. And when we use those to communicate with other healthcare providers or, even just within our team itself, looking back on notes that we were doing 5 years ago, huge improvement to what we're doing today with DocBuddy and being able to dictate those. So after we input our information in DocBuddy, it flows over very quickly into our EHR. I've always actually been really impressed with how quickly I can complete whatever work I'm doing in DocBuddy, and it's pretty much instantaneous that I can pull up my note in my EHR and then officially close it out. I do a lot of training with our new providers on DocBuddy. We have wonderful initial training with the DocBuddy team to hit on the high points within the system. But then since we utilize it in such a specific way within our company, I do follow up with all of our new hires and our providers and kind of go through the way that we've optimized it to utilize for our practice. It's been really great working with the DocBuddy team. I've always been impressed by the customer service. If we ever have any kind of technical problem or something that arises, DocBuddy is always very quick to respond and resolve that same day, usually within a couple of hours, depending on what the issue is. And I also like that we tend to talk to real people, and we aren't really talking to recordings or having to call some helpline or something like that. So very impressed with the customer service team. I would certainly recommend other providers use DocBuddy.